Good morning, and thanks so much for your time. I mean, this is a heartbreaking, scary story that we have to reflect at this time. What are you seeing and hearing, and where is it happening mostly?
Yeah, it really is across the entire region. It's interesting what I'm seeing. I mean, we are not in a full lockdown in Kenya. We have curfews, so I was able to go out this morning early, and every single primary school is locked, as you would imagine. Same in South Africa. They literally have padlocks around them. So this is the same for more than 100 million kids across Eastern and Southern Africa. Now, obviously, there are countries where some kids have digital access, a lot of it, in places like South Africa, not everyone though. But broadly speaking, 4 in 5 kids in this part of the world don't have online access, so they can't have the classroom translated to them. So missing out on this much school, hurts education, hurts those kids who rely on a meal. We see violence rates going up. So, yeah, I mean, it's unfortunately bad news across the board, though we know why governments have been so strict on containment measures.
And we know that a lot of these kids come to school, particularly just for that one meal. What are the efforts out there, James, the people who are trying to get food to them? What is happening on that front?
Yeah, so there's a lot of, exactly. So one of our big UN partners, World Food Programme, do a lot of school feeding. A lot of that's going on in communities now, urban communities, informal settlements, but also in rural areas. As I say, UNICEF is using radio with governments a lot. Radio tends to have the biggest, does have the biggest reach by a distance, again, reaching those really most vulnerable people. But we've got to be honest at this point, and there isn't enough feeding going on for those people who suddenly have lost an income. Too many kids still are not going to get an online classroom. They're not going to get radio. So what we're going to start to need to see as governments find a way to reduce containment measures, schools are going to have to be one of those first things. It seems that unlike the seasonal flu, the viral load that children have of COVID-19 is less than we've seen with other viruses, so that's good news. Now, everyone's going to be safe. Governments, but the individual citizens have done so much in enduring these lockdowns and curfews and so on. So we're going to have to be safe. Maybe it's 2 sittings of classrooms. How do we make sure in overcrowded classrooms there's physical distancing? There are a lot of questions to be asked, but we know we need to find those answers because we want to see kids in classrooms throwing their hands up, answering teachers' questions.
And getting that much-needed meal that they actually come to school for in many parts. Now, also, just looking at the rise in violence, what are you seeing? I mean, I'm just reading here that we're seeing, obviously, a rise in gender-based violence that's happening in a lot of countries other than the ones you're keeping your eye on there as well. So what are you seeing? And is it because of tensions that we're seeing now for people being on lockdown for such a long time? What is the cause, and what can possibly be done about this, especially in areas where you can't reach them?
Yeah, unfortunately, you're spot on. So it's a bit like the science. Everyone is working out what the reasons and the causes as we go. A big cause is the stresses on families. Another one, of course, when it comes to domestic violence is, those people who are being abused are being locked in with their abuser now for long periods of time. We've seen this in the northern countries, the US and Europe. We've seen their rates of violence increase. I know for South Africa, where you've got Childline, which is an amazing service for kids under stress and under threat to ring up. But, cases there rose by thousands between March just finished and March 12 months ago. So what can be done? Well, first and foremost, it's families and communities. It's communities, making sure that they are there for those others. We know there's physical distancing, we know there's lockdowns, but we know you can always be there for your neighbour if something is going wrong. Places like South Africa and many other countries in this region have Childline. That's a great service. But of course, at the end of the day, the greater onus falls on the abuser. The onus falls on those people. Yes, everyone's under stress. I've spoken to your people in your studio, but people in my house, colleagues and family, the people world over are under stress. That doesn't excuse taking it out on a spouse or a kid.
Okay, so, I mean, there are so many dangers out there, James. One is, yes, we're talking about the food or the lack of food, and that's hunger and possible death from that. We're talking about the violence. And then also, with the conditions now, a lot of these kids are not getting the much-needed vaccines they need as well, and we are heading into winter in many of these countries.
Yeah, and we've seen across this part of the world vaccination rates increase, malnutrition rates decrease, malaria decrease, access to schools increase. Incredible results because, governments, businesses, mums and dads have sacrificed so much to make sure this is happening. And like you say, immunisation rates, that's about health systems getting in place, mums getting their kids to that vaccine. And we're seeing those numbers fall. So we risk again these secondary impacts. We risk again losing kids because they're not able to get a vaccine because of this pandemic. So it's again about trying to find a balance. And I know governments are struggling to do that, but it's very important that mums and dads as well remember all these other areas. Somehow we've got to keep nourishment going. You've got to make, measles and malaria are obviously much bigger killers in this continent than COVID-19 right now. So it's about trying to do the impossible in some circumstances, but mums and dads and communities taking advantage of those health workers and saying, okay, great, with physical distancing, let us know, though, when our next, vaccination campaign is going on. We need it. Our kids still need it.
Yeah, and that's, in places where you have some control and you have some resources, and just imagine the millions in refugee camps and those who have been displaced who are facing a worse situation. Thanks so much, UNICEF's James Elder there.